Hi, Dr. Yass here. In this video, I want to discuss the connection of multiple symptoms to a single cause, which I found in an individual, which reinforces the point that if there is, in fact, a muscular cause of symptoms, it can create pain in multiple areas around the body. And I think for the average person, this may be a confusing concept because the medical establishment kind of isolates different areas in attempting to establish cause. So if you have back pain and knee pain, or back pain and ankle pain, there's going to be this preposition that the back pain is caused by one particular issue and the ankle pain or the knee pain is being created by a separate issue. And one of the points I would make to people is the fact that if these symptoms are happening simultaneously, the higher probability is that they are joined by a singular cause. And just to show you the expansive distance that you could have varying symptoms from a singular cause, in this particular gentleman's case that I treated recently, I think this really exemplifies that. So this was a guy who had pain at the right lower back, the left knee, and along with pain at the left knee, he could not straighten his left knee, and pain at the left Achilles tendon. So the pain is the left Achilles tendon, the left knee with an inability to straighten the knee, and the right lower back. And this had been going on for a while, and it finally reached the point to which the guy could no longer function. He was trying to do activity and just found it very difficult, extremely difficult to weight bear on the left leg. And for any sustained weight bearing period, he would find that the pain in the lower back became extreme and he would have to sit down. So the interesting thing, part of the Yass method, is that you take this thorough history and then go on and do a physical evaluation and basically ignore diagnostic test findings, as I've promoted for almost 3 decades now, because they just find structural variations that in more than 98% of cases I've shown, they are independent of the actual cause of the symptoms. In more than 98% of cases, it's muscle. So in this particular guy, we talked about his history. And so when I looked at his left knee, you could definitely see there was no question that knee was bent. Even when I said straighten both knees, he could not straighten the left knee. So I said, have you ever had any problems with the knee, any surgeries, anything of that nature? And he said, sure enough, about 15 years ago, he was told that he had pain at the left knee coming from a meniscal tear, so he had a meniscal surgery performed. Now, beyond the actual inability to straighten the left knee, when I asked him to pull his short legs up, the length of his shorts, you could see that there was a massive loss of quad muscle mass in the left side. So that kind of helps to connect why the guy is having the inability to straighten the left knee. So the knee extends or straightens with the strength of the quadricep muscle, the front thigh, and it bends with the hamstring. And there is actually a portion of the calf called the gastrocnemius, which actually goes beyond the knee. So it could be a factor in bending the knee, although slight, it can bend the knee. Well, if you were to lose quadricep strength, which is that desire to straighten the knee, then the hamstring and the gastrocnemius portion of the calf, the tone of those muscles, can actually cause those muscles to shorten enough to where they inhibit the straightening of the knee because there's just not enough length, flexibility of the hamstring and the gastrocnemius to allow the knee to straighten. So it was fascinating to see that not only didn't he have the straightening of the knee, but there was this obvious atrophy of the left quad. So that would help explain why, obviously, his knee is not going to function properly if it can't straighten when it's supposed to straighten during functional activities. So that could elicit pain at the knee. But the Achilles tendon pain connected because the gastrocnemius is a portion of the calf attaches into the heel at the Achilles tendon. So if the gastrocnemius portion of the calf had shortened severely, there was putting this excessive tone on the Achilles tendon. And if during the process of having to move his ankle, there was certain levels of ankle range of motion that was necessary, and that would be limited by the shortened gastroc attaching to the Achilles tendon, attaching to the heel. So now you have this understanding why the guy is having pain at the knee, pain at the Achilles tendon, and the inability to straighten the left knee. Those all connect. So what's the connection of the right lower back pain? Well, if you can straighten the left knee and you straighten the right knee, by definition, the right leg is longer because you can achieve the full length of the leg without straightening the knee. And since you can straighten the left knee, it can't be as long as the right leg. So for this period of time, almost 15 years, this guy has never fully weight beared on the left leg. He's been basically weight bearing through the right leg this whole period of time, which means that the right lower back muscle is the primary muscle supporting his weight through the torso as he's doing weight bearing activity, which would certainly allow the right lower back muscle to strain and elicit pain. So the right lower back pain was coming from the inability to straighten the left knee. This is the magic of the Yass method. It's taking things that exist empirically and explaining them. It's not hypothesis. Oh, I see something and I'm just going to guess that that's the cause of your pain, like a diagnostic test. No, these are where your symptoms are, and there is obviously a rationale for those symptoms. So we're going to try to explain those symptoms, which, as I just described, the inability post-surgery to fully regain the straightening of the left knee has caused this guy to have pain at the Achilles tendon, the left knee, and the right lower back. So here's what we did. We massaged out the quad because there was a lot of knotting in there because it had strained. We massaged out the hamstring and the gastroc portion of the calf. Then we did a little stretching. Then we did strengthening, isolated strengthening of the left quad with knee extension and lunges. Then we did hip abduction and hip extension, and we did some dorsiflexion to strengthen the anterior tib, the front shin muscle, to help lengthen the gastroc. And the cool part was that while we were doing these exercises, the guy mentions that while he's sitting in between, he no longer feels the Achilles tendon symptom at all. Then he stands up and says, holy cow, the right lower back pain is gone. And by the time we completed the exercises, he was basically able to fully straighten his left knee. So now he was weight bearing equal, 50% on the right leg, 50% on the left leg. And to me, one of the most satisfying statements the guy made was at the end of the session, this is one session about an hour and a half long, he said, I haven't felt this good in a decade. I feel like I want to jog. This is the guy who couldn't perform any weight bearing when he walked in because the symptom was so bad. And now the guy's telling me he feels so good that he feels like he is compelled to want to jog. 1.5 hour session, interpreting the presentation of his symptoms, understanding the muscular cause, correcting the muscular cause, resolving the symptoms, and returning the guy to a desire to want to perform at a much higher functional level. That's what the Yass method gets you. If you think this video is helpful, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe to get notifications when new videos are added or when I'm live on YouTube. If you want to contact me, if this is kind of put a little bug in your ear that maybe this is the right path for you, then please contact me by email at drmitch@mitchellyass.com. Or if you decided the Yass method is the legitimate path that you want to take, then you can schedule a Yass method Zoom session by going to my website, livewithoutpains.com, livewithoutpains, plural.com, and you can schedule a Yass method Zoom session for the day and time that's most convenient for you. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.